Nitsisnayment First Nation. Our meeting is going to be live streamed and video recorded, but there's no audio for those, so Councillor Eastermere is looking after our Jennifer, who's coming in by Zoom because she's away. Introduction of late items, Ms. Curry.
Yes, thank you, Chair. So for late items, we are adding presentation titled Community Safety and Wellbeing, City of Nanaimo's Fire Rescue Statistics as agenda item 5B, and reordering the remaining items accordingly. And that will be introduced by Chief Doyle. As well, Chair, you had some correspondence that I was just trying to search for that was not added to the agenda, but you would like to speak to it?
Yeah, I can speak to that under late items, Ms. Curry. It's just an email that I just wanted the board to be aware of that we got from the South End Neighborhood Community Association about their concerns about baby, which we can address when Ms. McNaughton does it, just so that people are aware that we did receive an email from them. And I'll ensure it gets attached to the minutes for the next meeting.
Perfect, thank you so much.
Adoption of minutes. Any issues first? Okay, it's moved by Scott, seconded by Ruth. All in favor? If I can get you guys to switch your tags this week, because I still can't remember everybody's names. I'm getting there. I should be there by the 30th. Okay, thank you. The motion passes. Oh, sorry, adoption of the agenda, which I didn't do. Moved by?
I have a question on the agenda. So last meeting we had indicated that there'd be time set aside for a neighborhood group that wanted to provide an update as to observation of the city understanding an agenda item.
Ms. Curry, if you can take that,
Yes.
because there was discussion around that.
Yeah, so after a recommendation comes from this committee, it goes to council meeting for approval. So council has to adopt any motions that come from your meeting and recommendations. And they did not. They said that it would maybe be added as, do you remember how it was worded though?
To a request as a delegation. I
Yeah,
believe.
so it was to be requested as a delegation because it didn't match the terms of reference of the actual committee itself. And it would alter the terms of reference to what they actually had been.
And also, there's also an option for them to come in question period as well.
Yeah.
Except for they wouldn't be able to express, they can only ask questions about the agenda, but they're definitely coming as a delegation and say this is what we want to talk about, similar to what we have as our delegation coming today about the baby school. And I think maybe Ms. Green could add that to fan out to the neighborhood association.
Yes, certainly.
Thank you. Okay. Moving on, motion for the agenda now that we've discussed that. Any issues? Oh, moved by Colin, seconded by Hillary, I'll just pick. All those in favor? Motion carries, thank you. So our first presentation is going to be introduced by Inspector Andrew Burton, who's the acting officer in charge of the Nanaimo RCMP. But I'd also like to acknowledge Chief Superintendent Shauna Barr, who is our Island District Officer. She's responsible for all the RCMP detachments on the island. She's here to hear the concerns of Nanaimo, and I will now ask Inspector Burton to come up to the podium and start the presentation. For the audience, there's no opportunity for you to ask questions if you have Inspector Burton. However, our committee can, and you can ask questions at any time, but I ask you to put up your hand, I'll acknowledge you, and then we'll go from there, if that's all right with everyone. Just send you the message.
So everyone would have to have in the agenda package. Pages that are not as that are in the agenda.
Okay, just so you all know, there's a couple presentation slides in here that are not necessarily on there, so if you have questions about that, please feel free to ask Inspector Burton. It's all yours.
Thanks, everyone. Appreciate you taking the time out of your days to come and listen today. As the chair suggested, my name is Andrew Burton. I'm the inspector in charge of operations support here at the Nanaimo Attachment. I'm pleased to have with me my boss, Chief Superintendent Shauna Barr, who is the the district officer, so she's in charge of all of the Island District, 26 detachments. She comes to us from Vernon, North Okanagan, and interesting note, she started her career in the RCP here in Nanaimo, spent 15 years here in Nanaimo, so is very well versed with some of the issues that the long-standing issues.
Judge Callan remembers you.
You did an excellent job.
Thank you.
Excellent. You can't get more of a resounding.
I'm done.
I don't have the slides for the first part of my presentation, but I think you've all got the handout. The title is the Nanaimo RCMP 2024 Public Safety Statistics. And of course it's not there, but I think you've all got it so we can follow along. And I'm going to read a little bit about this. I've made my own notes about it, but it does give a fairly good, accurate picture of where we're at. So, oh look, there it is. Okay.
Oh,
Excellent.
because I don't have that in my package.
Okay. So since 2019, calls for service have been decreasing steadily, with 2023 having the lowest calls for service over the 5-year period. However, it's a little bit misleading in that the severity of crime is increasing, as indicated by the CSI, or the Crime Severity Index. And this can be attributed to an increase in assaults, robberies, weapons offenses, and homicides. Drug possession files have dropped drastically in 2023. Largely due to the decriminalization of drugs under 2.5 grams. Over the 5-year period, property crime has decreased 29% between 2019 and 2023. Among the property crime file types, break and enter saw a 46% decrease since 2019. But despite the decrease in overall property crime, theft of auto and arson did see an increase in 2022. When comparing the year-to-date stats from January till March, crime in 2024 has been lower than in 2023 for the same period. However, that's obviously not a guarantee that we'll continue to trend in that direction. You can see there the graph where it talks about the year-to-date for that specific time. Federal statutes you'll see in red now near the bottom on the right, it's an increase of 500%, which is it's gone a whopping. We had 1 last year, and we've got 6 so far in 2024. So six files sounds significant when you say 500%. Federal statutes would be things like Customs Act, tobacco seizures, Harbor Commission Act, DNA Identification Act, and Firearms Act. So I don't want anyone to start losing their mind over a 500% increase, because it is when you put it into perspective, it's not tragic. Do I move this one? Or?
Now we're gonna move it for yes, because he's got some
Your overview, perfect. So you'll see that since 2019, calls to service have been trending down, with the lowest total occurring in 2023. Reports to Crown Council have also trended down since 2019, but increased 10% in 2023. Criminal code charges have also trended down since 2019, but increased by 71 to 71, which is an 8% increase for 2023.
Just a question on that, because we hear from, and I know members of this committee have heard it too, that a lot of people just start calling them in because they feel nothing's happening. Would that be one plausible reason as well?
Certainly, there's lots of reasons why crime rates will fluctuate. Obviously, one of the concerns that could be contributing to that is the lack of people calling it in, and I encourage people to pick up the phone and make the call. I think it's easy to get frustrated and say, nothing's going to get done. I've called before, nothing's going to get done. I can tell you, nothing will get done if you don't call the police. So you have to call the police each and every time. And I mean, I think if there's one of 10 takeaways today, that's a really important one. Call the police. So that could be a very good point.
Ruth?
Yes, I have one other question. Is it possible that
the creation of the community safety officers has helped to triage some of those calls away from the RCMP as kind of.
Yeah, that's an excellent point, and I think that's a real valid thing. Since the introduction of the CSOs, we have seen more of a shared responsibility for some of the disruptions that would normally be faced solely by the police. Good question, thank you. Okay, moving to the next slide, 5-year overview on the violent crime. Perfect. So the CSI I mentioned earlier is the Crime Severity Index. This peaked in 2019 after decreasing in 2020. And the CIC, since that, the CSI has been steadily increasing. This is as a direct result of violent crimes, including assaults, robbery, attempted murder, homicides, as well as weapons. We all saw a peak increase in these in 2022. Happy to report they are going down a little bit in 2023. We also saw a decrease in sex offenses in 2022, but a bit of an increase in 2023. And you can see the graphs on the right-hand side, the trending lines. Next one, if we're able to move it. Property crime. Property crime has reached its lowest total in 2023 over the 5-year period. Theft of auto peaked in 2022 before decreasing by 18% in 23, and this includes the actual theft of vehicles, attempted theft, and what we call a taywalk. You take auto without consent. Someone thinks they're entitled to take your vehicle when in fact they're not. Since 2020, arsons have greatly increased. Arsons peaked in 2022 with 129 files and then decreased by 28% in 2023. Prior to coming here today, I spoke with our statistician, our crime analyst, not criminal analyst, but crime analyst. And in this period, since the start of 2024, and this isn't on the slide, we've had 6 arsons in 2024. For the same period, for comparison's sakes, January to April 2023, there was 27 arsons, and in 2022 there was 28. So this is down considerably for the same period of the year. Moving on to the drug side of things, drugs and traffic, mental health stats. You can have a look to digest the graph there. You'll see that apprehensions under the Mental Health Act have increased in 2020. With a peak of 813 apprehensions in 2023. Mental health related files increased by 9% in 2023. And on the traffic side, impaired driving offenses, and this is including administrative and roadside driving prohibitions and fails on the approved screening device, the roadside screening device, have increased yearly since 2019. And this could be attributed to the increased traffic enforcement that the detachment has taken on.
Could that also have an impact because of legalization of cannabis? Or not legalization, but a small amount, that you're seeing more people impaired by cannabis?
Yeah, that's a potential factor as to why. I like to think it's because we're out there doing a good job, but yes, there's always that potential for the different types of intoxicants, absolutely.
There's been people that have said that when there's a major drug trafficking bust, that overdose fatalities have increased as a result. Is there any evidence to suggest that that's a case?
That's interesting, and that's not something that I'm familiar with, that train of thought. But it's interesting that someone would have brought that up. I'm not aware of anything statistically through our analyst.
Okay, I'm just interested in that as a question to answer whether that is something that happens, because there are advocates for drug user advocates who say that is something that happens. I don't know if it's true.
Thank you. So I'm kind of looking to the chair for advice here. I've got a second part of my presentation. Okay. Do we want to talk questions on the stats now, or do you want me to go through the annual performance plans, listing priorities?
Right now that they want?
I just have a general question about the statistics, Kevin. I'm just curious, you see all the graphs, there's lots of different, you can break down the stats in many different ways. I appreciate that you want to take credit for all the good stats and and maybe not as much for stats that increase. But is that always attributable to police actions? Like, how deeply do you go into those statistics? Because statistics, it's just a number. There's lots of graphs, there's lots of reasons why statistics there's so many variables in all of these things. Like, what do you actually do with those numbers that makes a difference? We can look at them as a committee over the last few years and go, oh, it's a nice graph, or that looks good, but is it, I guess is my question, like what do we take away from that?
Well, and I think, and that's a good point, Kevin, and I think stats I don't think anyone who's done any statistical work knows or taken the course knows that stats can be interpreted any way to side with whatever. I can assure you that the stats that I bring are the truth. And they're not biased. But in all seriousness, they are a tool, and we often use the stats to identify what we call hotspots, where we could look to upstep our enforcement, where we should be looking. Like we've seen a lot of issues with unstamped cigarettes or youths gathering and things like that. That's where we can increase our enforcement. So it is not the be-all end-all, but it certainly paints a little bit of picture, and it's one of the tools that we use as law enforcement to direct where we're going to go.
Can I ask a follow-up?
Of course.
Just with the stats, one thing that tends to happen is you have the stats, so you focus things. I mean, I don't know how you work internally and you consider where you need to apply enforcement or how you need to change the way you operate in certain areas. But often you get one incident that tends to grab a lot of media attention or overshadow something else. And so I think people falsely get an idea that is a new reality or a statistic, but really in essence, it's an outlier from a statistic. It doesn't actually really factor into it too much. Do you find that police attention is drawn to those, or do you guys try to keep it pretty focused on the main goal?
I think it's easy to fall into the trap of keyboard warriors and Facebookers and fall into the panic that's often we see more with the social media. I like to think that our organization is a little bit more statistical minded, and we go on the facts. Obviously, we respond to complaints and things like that where we know that flying the flag probably isn't going to work, but perception policing is what I like to refer to it as, and we sometimes will engage in that because I think it's a safety thing, right? Whether or not it's statistically proven to make a difference, if it makes people feel better and feel safer, then that's certainly our responsibility. But as a whole, we're more fact driven than otherwise we'd be going 1,000 different directions.
Colin, then Ruth.
So for the Nanaimo RCMP overall, what's the impression or the outlook in terms of the efforts that have been put in since the CSO program has come into place, since DCRIM? What is the RCMP's opinion or feeling of how this is going in terms of public safety?
Yeah, I think there's been studies done with regards to community safety, and I think there's been a lot of thought gone into the plans that have been rolled out on behalf of the city with the CSOs. I'm very impressed with the CSOs. I recognize that it's one more tool. We all have to abide by the authorities that are. The law is the law, so we're not going to be stepping outside of that. But the relationship between the CSOs and the RCMP, I'll tell you, I was a little skeptical at the beginning, but very, very pleased to be able to say that I was proven wrong from a relatively early on. From the start, I wasn't sure where it was going to go, but I'm really pleased with the way that's gone on. I think it's made a big difference. Now, it calls for service for sure is one of the questions, but I think it's a more concerted effort towards in this instance the downtown public safety. So I've been pleased with it, and I think that it's a real step in the right direction.
And then overall for Nanaimo, how is the RCMP feeling about the public safety in Nanaimo?
Again, if I'm going on the stats, I'm comfortable with where we're at. I'm a Nanaimo resident. I've been here 2.5 years now. I live on the south side, so I'm comfortable with where it's at. Is there always room for improvement? Yes, there is. Do we have some social issues that may not necessarily be criminal in nature? Absolutely. This is my 10th stop along my policing career in 31 years, so I have been to another place or two, and I recognize that some of the situations that we're seeing here are global. They're situations that we're seeing in other communities across BC and my time in Saskatchewan as well. So I don't know. I live here, so I don't really care what goes on in all my other postings anymore, except Port Alberni. My parents still live there. But I think that I think that we're doing the absolute very best with what we have to deal with, and there's a lot of social problems that aren't necessarily criminal in nature, but left long enough, do become criminal in nature. So we've got some social issues that need to be addressed. I'm not necessarily going to take ownership of that, but those are things that we as the police need to contend with for sure.
Yeah, like a lot of times if society doesn't know what to do with something, they give it to the police to deal with. Prime example is our mental health crisis, right? Instead of dealing with it through mental health professionals, it's dumped into the police's plate, which in my opinion is wrong, but Ruth?
So just going back to the community safety officer, so we're seeing the RCMP statistics and decreasing calls, and I'm speculating that the CSOs can be given credit for that, triaging, so to speak. Is there any way to sort of get the other half of those statistics and to see, if they match up in terms of what, was that a question for you?
Dave?
How many calls the CSOs are getting, et cetera?
Yeah, thank you very much, Chair. The CSOs are responding to about 1,000 calls per month. And we know that some of the presence of social challenges, particularly downtown, are ubiquitous throughout the area. So the need often outweighs our capacity. But the important thing about programs like CSOs is we can free up policing resources so they can concentrate on more serious aspects of crime. Because a lot of the work that CSOs do is to manage disorder, to de-escalate situations of immediate crisis, these types of things.
I think the other part too that I'll add from a CSO perspective, they're not labeled with, or they're not tasked with all the paperwork that comes from a police officer, and so it allows the police to focus on more serious stuff, and I personally really like the program. Judge?
I'm not familiar with the room, but I just wondered whether there's audio for the people in the back that they can hear us up front.
Can you hear back there?
If you're speaking a little softly, not quite, I'm
Me?
asking you, it's not you, no. You're always loud.
I just go down
On Victoria
there.
Crescent, I can hear you right now. No, it's just, it is a little, somebody doesn't speak up.
Shauna, you don't have to laugh that much. Thanks. Kim?
And so I just had a question for regarding the 1,000 calls a month. Who generates those calls, or who are those calls coming from? Because as a resident, I don't have the phone number, direct line number to a CSO, and would I even know to call them if I weren't kind of a little bit aware of the CSO officers and what they do?
Yeah, right, a great question, thank you very much. So a lot of the big downtown community stakeholders and business community have direct access to the CSOs through a number of the duty phones they carry. For the rest of the community, they can call the city through the bylaw department or public works, and they'll connect and dispatch to community safety officers. But a great deal of the work is self-generated, and that amounts often to engagement and wellness checks with the marginalized populations downtown. So when I say 1,000 calls in a given day, they might do, and I don't think we even count them as calls, 30 or 40 wellness checks in an afternoon.
And just so people are aware, the city does have a review of the CSO program, and I think it's coming to us in the next month or so.
Yes, on April 29th, there's a governance priority committee meeting, and we'll be bringing a report to that meeting.
Because we're looking at the effectiveness, because right now the CSO is only focused on downtown, and is there a role for it outside of the downtown? Ruth?
One last question about the CSOs. Are those statistics available publicly about how many calls and what kind of calls they are? On a quarterly basis or on any basis?
I don't know that we publish the CSO statistics that's forward-facing to the public, but certainly they're available and we can share them with this committee or anybody who's interested in seeing them.
Okay, we'll move on then, and now what we're going to go to is, I believe it's the annual performance plan, is that correct? Bruce?
Yes.
Thank you. That's their priorities for the year.
Perfect, thank you. So what you're seeing before you now is the annual performance plan policing priorities, the APP, PP. And this year, this is a mandated thing from the federal government in Ottawa, where each detachment and unit is required to put a plan forward for kind of a roadmap of where we're going to go for the following year. So we've established priorities. And of course, being a federal government agency, we are driven from the top down. So the APP consists of national priorities, division priorities from E-Division or British Columbia, and as well island district priorities from our district. And then we look at, not in that order, but also included in that is the detachment and the community priorities. So again, we look at what's important to our communities. So for Nanaimo, we're looking at the City of Nanaimo, Lantzville, and our 2 First Nations. So we've got 4 people that four organizations that we tailor this to. What I'm showing you here today is a bit of a broad spectrum of what it is that we're going to be looking at. This is by no means an in-depth roadmap, nor is it a solution to everything. It's 5 priorities that we're going to be looking at. I just wanted to give you a bit of history as how this is developed. And again, it's statistically, like I talked about with our I call him Dan, the stats man. He identifies hotspots and areas and crime areas and trends that we're seeing, and this is what we're going to look at. It's by no means written in stone. It's updated quarterly. We go through it and we address to make sure that we're on track and meeting our benchmarks throughout. And this is all monitored through Chief Superintendent's shop at headquarters in Victoria. So as I said, we've got 5 priorities that we are going to be looking at this year, and again, they're a little bit broad. We talk about crime reduction, which is obviously with the police. That's what we do. And the first thing you'll see there is REVOI and SIGHT. REVOI is a relatively new program that was started by the provincial government, and is basically it's not a police-led function. It is actually the chair on this is BC Corrections Probation. So essentially, all the stakeholders determine what the people who are repeat and violent. That's the thing. That's the key to get on the list. You want to get noticed by REVOI, be a repeat or a violent offender. That's going to get you on the list. And so these are the I don't want to say worst of the worst, because that sounds like I'm putting stigma on people, but people who are having a little bit more difficulty learning. So we've actually, in Nanaimo, we've started, and I believe the only SIGHT team in the province that I'm aware of, where the special investigation and targeted enforcement. So we've dedicated a group of officers to go out and ensure that these people are being held accountable. There is a special Crown Council that's been established to deal with once you're designated as a REVOI client. There is special attention given to you to make sure that it's followed up with the identified mandate throughout the whole justice system. So we've seen some real good success with that through our SIGHT people. On the violent offender management. PTEP, another acronym, Provincial Tactical Enforcement Priority. This is led by our projects or our drug section, these people are again identified as mostly through organized crime. A lot of high-level drug traffickers. These aren't your street-level drug dealers, but they're all connected. So if we can cut the head off the snake, it should have a trickle-down effect. So through PTEP, we're working with our projects to identify and action law enforcement against those people. Youth is always a big thing. As a father and obviously engage with the school system at some point. Youth is a big thing, and I'm very pleased with the relationship that Nanaimo RCMP has with the school district. We have an excellent and robust youth section, which is focused on dealing with issues that are almost significant or special to youth. And what we're seeing a lot of is gang recruiting, where some of these adult criminals, organized crime, recognize that the law takes a different view of young people, so they're actually employing, which is quite heinous, young people to do their dirty work. And we're seeing this more and more in communities outside of Nanaimo, and sad to say in Nanaimo as well. So youth is a big thing with keeping our gangs at bay and keep them away from. And I think one of the things that we spoke yesterday at the regional district was what we're seeing is gangs are getting people to young people, sometimes middle school or mostly high school, to sell vapes, the electronic cigarettes, and then if they do a good job with that, then maybe they're moving on to other things. And these are things that we've seen, and this isn't even costing these people a lot of money. It's a fancy hoodie or the newest runners, and that then they recruit themselves. Hey, where'd you get those runners? I got a guy you should meet. So we're really seeing that it's a great business model, but we're doing our best to combat that.
Question, Colin?
Just, it's really hard to even hear like that's going on, but so Revoy, Site, and PTEP, how many, like in Nanaimo, how many people are being watched and tracked, like generally speaking?
We've got a dozen Revoy clients in Nanaimo. I think there's 40 on the island. We have a 12 that are designated with us, and at any given time, I'm proud to say the work that these guys are doing. We are seeing some really good people aren't being released back onto the street as quickly as they perhaps might have been otherwise. So as far as numbers go for PTEP, I can't say. I just can't say. Does that answer your question?
Yeah, thank you.
Okay, moving on to the next slide. Is that me? Yep. So always with any organization, employee wellness is key. We have to have healthy people doing the work. You see at the top there, ODS management. ODS is the RCMP's term for off-duty sick. So we have, like any organization, we have people who aren't coming to work for various reasons. That puts an added strain onto the rest of the members that are at work and the support staff as well. It increases the workload and it can have negative effects on morale. So one of the things that we're alive to and working on is to keep our employee morale up, and that's across the board with our regular members as well as with our support staff. So I think that we do a good job. I believe that morale in Nanaimo is high, recognizing that policing is a tough business and that it can take its toll on people. I think that we've got really strong, resilient people for the most part, and we're working hard to keep it that way. So that's kind of just a little bit on that. And again, we talk about ensuring employee wellness through education and awareness. We've got programs that we're working on in order to keep them healthy and coming to work, healthy, happy, and coming to work. Inclusion and reconciliation. IPS is Indigenous Policing Services. We have a 2-person unit here in Nanaimo, and we've had some challenges with staffing those positions, and I believe that we haven't done a fantastic job of policing with our Indigenous partners. We have a dedicated unit there, and if they're not there, it falls on that work falls on to the general duty members. And these are specialized members that work in IPS. So we've really got to pick up our game and get re-engaged with our communities and to build trust through enhanced communication. And, you can work really hard, but it takes one sour thing to turn things. So, and I don't think we've turned it, but I think we're mindful of the fact that could happen. So that's really important to me, is the reconciliation and the re-engagement with our First Nations communities.
Can I ask you a question for that?
Certainly.
Yeah, thank you. I'm just curious, do you do any outreach recruiting or anything like that in Indigenous communities? Like, I know it's something in our organization, like we do, we're trying to take it out there and actually get people from the community, maybe with, I know how, Depot seems to be a, good luck, you're going somewhere, but maybe there's a way to like send people back to where they come from in order to.
Yeah, absolutely we do. And and I can speak a little bit to this because in a former posting I was in charge of Indigenous policing, so we recognize that, and the RCMP takes steps to recruit Indigenous people into the organization. Again, part of this we talked about is the trust, right? That we've got some bridges to rebuild with as far as trust goes, and I think that's done on the backs of our frontline officers, especially in Indigenous policing. So we've seen some success with that across the province. One of the things that the RCMP is alive to is we're all after the same people. We're all trying to recruit the same people. And one of the things that we're seeing is there's not a lot of people that want to do this job anymore. So we're doing what we can to make it more attractive. And one of the things is and the Chief and I spoke about this morning, is the pre-posting agreement. So there's opportunities now for, if you're from a certain community or a province going through to Depot, we've got the pre-posting agreement. Our Depot is our training center, where if you're from BC and you want to come back to BC, BC, chances are you're going to come back to BC. We're agreeing to that. I don't know how long that's going to go for because poor provinces like Saskatchewan and Manitoba aren't faring well with that pre-posting agreement. But certainly BC is seeing an uptick in that, and certainly with regards to recruiting of Indigenous people, yeah, we're all over that.
I'll just add, because I ran the First Nations program here before I retired, we had a summer program as well where Indigenous, I don't know if you call them cadets, I can't remember the name.
Cadets.
Yeah, Indigenous cadets would come here, and it's been 2 to 3 months with our Indigenous unit, and as a result of that, we had 2 actually of the cadets join the RCMP, and 1 is now posted back here. But a lot don't want to come back to their home community at first because there's just too many issues for them to deal with, so they want to go learn about policing first and get strong knowing that and then come back. So that is something that you have to really look at too. Because everybody says, oh, they want to come back to their own community, but when you talk to a lot of them, they don't. They're just not quite ready.
Chair, I just want to make sure that the committee member Jennifer Milbank can hear. Just because I let her know we had audio issues, so we actually have you on a phone on Zoom.
Yeah, she said she could.
Okay, perfect.
Thank you,
Yep,
Ms.
I can hear it, thank you so much.
Go ahead. Any
Sorry,
other
yeah, thank
questions on that?
The last initiative, the fourth initiative is community and public safety. Again, very timely given the audience that we're here today. Mental health issues is it's a big thing for the RCMP. We deal with this. I wouldn't want to give an estimate of what the percentage of mental health calls that we go to, or perhaps that there's mental health issues with regards to the calls, but it's significant, and we recognize that, and that is a huge part of community and public safety. So we do have a full-time mental health liaison officer who works in partnership in the same police car with a psychiatric nurse. And so the 2 of them go around and proactively reach into people who are in crisis, or will respond to our general duty patrol, people who have got a problem with someone who's in crisis. We call in the specialized team, and they're able to work with that person and able to hopefully smooth the journey, because again, this is something we're seeing more and more and more of, and these people are ill. They're mentally ill, so we need to treat them as sick people as opposed to criminals, which sometimes can be a dicey line, but that's where we're at.
Ruth?
One question about the car that would have the officer and then the mental health, would it be a psychiatric nurse?
Right.
Is that available 24 hours, or is that only, because I used to run a community police office in the downtown east side of Vancouver, so they call it Car 86 or Car something, and it was like, oh, that car's, they're not available, so that can create a bit of unfortunate situation when, they're not available. So is that?
No, this is unfortunately right now we're looking to have additional members, and we've got nurses that are ready to join us. It's right now we're just not able to provide that service on a 24-hour basis. But I will assure you that our officers are very well trained. They're not doctors or nurses, but they do have extensive training in dealing with de-escalation and crisis intervention. So and I think of a guy who started 30 years ago, and versus what we're seeing now, they're very well trained in that. So it would be ideal to have that specialized team. Unfortunately, like mostly everything, it's not available after hours.
Yeah, so it's go ahead. Monday to Friday kind of.
Monday to Friday, yeah. 8 to 4, 9 to 5.
Yeah, okay, thank you.
Any other questions before? Jennifer, do you have any questions?
No.
Okay,
Thanks.
thank you. Okay.
Okay, moving on to the fifth initiative, which is recruiting. As I alluded to earlier, the RCMP is was experiencing critically low applicants to the force. That I think through some of the things that we talked about earlier with the coming back to your home province and getting a say into where you're going to go, that's increased, and we're looking at ramping up more and more as we go. Nanaimo detachment as the biggest detachment on Vancouver Island is certainly aware of this and recognize that we need healthy, happy people here. So we've included this in our annual performance plan as a priority to recruit. So we're committed to doing. The boss said too. We're committed to doing 2 recruiting sessions per year, and at a minimum, and some we've done significantly more than that, but we've committed to doing 2 with the help of our friends at Island District, and we've got an officer designated to be in charge of recruiting locally, and we've done things at VIU. We've had job fairs. We've even had even lower key coffee with a cop. We've done open houses and things like that. So we recognize the value in we see things a little bit different. We see, wow, this person that I'm talking to would make a great police officer or has got potential for it. So we're all recruiters, and I think just on the numbers, I don't want to get them wrong, but I spoke with the chief this morning, and we are looking at 42 troops a year of 32 people, which it hasn't been like that for very long. COVID, we saw as little as 24, and sometimes graduating troops of 7. So the fact that we're getting our numbers up is a real credit to the push that we're seeing across the organization. So.
And just to add to Inspector Burton, Chair, is that we currently have 748 people with pre-posting agreements at Depot currently, and if all were to make it through, that's 748 people that would be coming back into E Division, which is British Columbia, many of which would be, the lion's share would be coming to large detachments, small detachments, and it would help us fill a lot of vacancies. So the pre-posting agreements and the increase of manpower at Depot and running the increase of troops has really paid off. We're finding that with proactive recruiting, we're actually there.
Awesome. Good news.
Chief, if I could ask, is your recruiting keeping up with the attrition rate in recent times?
Oh, that's good.
And thank you, Chair. I'll answer this for Mr. LaBerge. It's very hard to estimate because people can retire at any given time, and we're seeing that. So it doesn't necessarily mean that people do 30 years or 35 years anymore. They can retire with as little as 15 years. So it's hard to predict the amount. But with 748, say if everyone passes there, and let's say possibly a 17% attrition rate, with us getting those individuals back, we're in a lot better shape than we ever were. I'm fairly optimistic because right now I'm having conversations with staffing fairly regularly in relation to where we're putting people and where we're putting recruits. Obviously, in order for recruits to come from Depot, we have to have the capacity to train them. So sometimes some small detachments don't get that. But what that does is it frees up someone from a larger detachment to go to the smaller community, and we bring the person to be trained into a larger detachment.
And just to add to that, because a lot of times detachments don't want to take the cadets, but Nanaimo has always taken the cadets, which means our numbers are always better than a lot of places.
I would suggest it's a great place to learn.
Oh! I remember when she was here on her rotation upstairs with me.
That's all I've got. I'm certainly, if there's any outstanding questions, sorry.
That's okay. Maybe for the inspector or the chief. I guess what our committee needs to figure out some priorities. You got any ideas for us? If you had to focus this committee in some direction, are there things that come to mind for you? For Nanaimo,
Yeah, let's let the chief come forward. This is political.
That's not a fair question.
No, I like it.
And I think the thing is you have to look at public safety and the perception of public safety. Those are two different initiatives. And we can all agree that just because something is existing somewhere, that might make someone feel unsafe. So in relation to, say, the street and trench addictions, mental health issues, often the presence will make sometimes a community member unsafe. So we still have to pay attention to it because if someone feels unsafe or if they are unsafe, it doesn't matter. That's how they're feeling. So we have to look at that. So I think that's something that you have to look at. Right now, in relation to the current opioid crisis, obviously, and I don't say this lightly, but I remember back in the days of being downtown on bikes and heroin was the worst thing that would ever happen. And we're looking at it now and it's almost bad to say the good old days of heroin, and that's awful to say, but with the drugs and the toxic drug supply that we have now, we're playing a different game. So you have people that are severely addicted and doing a lot of survival crime. And I think compassion is always a great thing, trying and meet people where they're at and trying to get them the supports. But in order for that to happen, the supports have to be available. So sometimes our hands are tied in relation to, we know people that we would like to get into supports. We often sometimes can't find those supports. And so I think that is something from a community perspective. The role of the police is to reduce crime. And if we can take someone off of the waterfall, that has fallen off the waterfall and put them on shore, that's what we wanna do, so they're not going to fall off again. Unfortunately, right now, it seems like that individual is just getting plucked out of the water and put at the top of the waterfall right now. So I think as a community, it's a community-led approach, working with the police, and all public safety in relation to try and focus that direction.
So I'll go something back to Jennifer had said when we were talking about the grouping, the advocacy role. So perhaps that's, the advocacy for more treatment beds, more detox beds in our communities. A concern that was raised to me by a citizen was the revolving justice system, right? The report just came out that out of the ones that Crown Council had requested to stay in jail, 57% were still released. So is there a role for something like that where we're looking at some of these offenders that keep getting constantly, I talked to a young member, he says, I'm not arresting him again, I've been arrested him 7 times this week. They keep getting released and released and released, and I know that the judges are, caught by certain things under the Bail Reform Act, but is there a role, because we know the police usually can't speak out on that, right? You can't criticize the judicial system. I certainly have no problem doing that now. But, because there's areas where there needs to be improvement, I just read the decision in Ontario where they just let all those sexual assault offenders go on the young children because there's no judges. And they came out hugely against, the judge came out hugely against the Prime Minister. We have got to get these positions filled, and I know that when I spoke to Farnworth, and this would be last year, Dory, I think, we mentioned the fact that we're solely missing crowns here that could do the high level cases. We only had 1. And he listened and we started to get more prosecutors. I give him a lot of credit because I think as a soldier, and I think he really cares and he's trying really hard. I really believe that, but he's one person, right? So is there roles like that where we can advocate for the treatment, detox, more Crown prosecutors?
Yeah.
Sorry.
No, sorry to interrupt, I talk too much.
Well, I'm
Tell
like
me to
that.
shift if you want, that's cool. I guess the problem is, and from a committee perspective, it's lots of people advocate for that. So, okay, we can, yeah, sure they do.
I
mean,
don't think so.
I think they do. I think
I
people,
don't think so.
I think there's a lot of advocacy for it. I guess my question is, what do you do when you hit that inflection point, right? We're in crisis management, you do the same criminals over and over again. You resuscitate the same person over and over again. They go to the hospital, they come out. What do you do, in terms of housing and treatment and getting people there, and how does this committee fit in that gray zone? I mean, you can say, hey, here's a great place for you to go where there's all the supports in the world 24/7, we'll get you better, we'll give you what you need, and we'll help you, and that would be lovely, and that would stop crimes and survival and all the other things that go along with mental health and drug use and stuff like that. If you had this big wonderful place that you could build with $1 billion, it's not going to happen. So what can we advocate for as a committee, or what discussion can we have that finds the gap between a call for service, go out, deal with somebody, come back. That's one thing, and everybody's doing their job. I guess I feel a little lost in terms of what we can do as a committee to actually say, okay, we can advocate for that. We can all put our names on it. We can write it. It can go to council. We can do it. That can be more represented at UBCM. It can go where it needs to go for that advocacy. But honestly, I don't mean to sound a little defeated, but it's so what? What's that gonna happen? Where does the money come from? What do we do? And how can we maybe do that as a committee? How can we push it? And I'm a little lost, so I just thought I'd put that out there.
So from a committee perspective, our committee makes recommendations to council, right? So if we're hearing this and a recommendation we need, and I'll be honest, our council's constantly advocating. I don't think there's a mayor in this province that has spoken out about the drug and mental health and brain trauma issues as much as Mayor Croghan. He is constantly on the news, he's constantly being quoted. Our council is very committed to pushing for this. We've got, you're right, but I think unless the general public starts speaking, and there's an election coming up, we're not gonna have as much stuff. It has to come, and that's where I see committees as being more important than just council. When there's a group of the public saying, this is what we want, prime example, the number of applicants for this committee are tripled any other committees. It was unbelievable the number of people that want to be on that because it's a number one issue for a lot of people. So we have to look at that. But the other thing that we can't solely focus on, and this is what I was concerned about when I voiced it last time, this public safety committee is not just about public health or the public health crisis or the addiction crisis, mental health. We're going to have a committee or a speaker coming up talking about road safety, right? We're concerned about our children. They can't go to this school safely, or you know, we may have like the constant accidents at one intersection, you know, what are you gonna do as a city to help me with this? So I think we have to remember that this is one aspect of public safety, you know, and that's what I was concerned about because it's our number one issue, right? Let's face it, drug addictions right now across the country is probably one of the biggest things facing everybody, but we have to remember there's other stuff as well. And we can get some small wins, right? Which does make you feel better when you start to see some of your recommendations being implemented by council. It could be, you know what? We don't like the policy that you've got to identify how sidewalks are going in the city. We've heard from the public and we'd like to see this be used, blah, 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 right? Ms. Curry?
Yeah, thank you, Chair. So,
Cognizant of the time, yes.
yeah, I just note on the agenda, we are gonna be having a roundtable discussion about, about our work and our mandate, and I think this is great discussion for that, but I just wanted to know if, Inspector Burton wanted to sit down, if we were done with them, if we were done with them, and just to remind you that, Chief Doyle is the next on the agenda, and then it'll go to the
Yeah.
third president.
So is there any other questions? Are you staying until the end or?
Yes. Yep.
Because I know there might be some questions from the audience. Awesome. Okay, Chief Doyle, please. Thank you very much, Inspector Burton, and thank you very much, Chief Superintendent, for taking an interest in the community. Appreciate it.
I was happy to let Chief Burton speak the whole time, if that's But looking around the room, firstly, I'm honored to be here and grateful to be speaking on traditional territories of some of the First Nations. And I'm also really excited to look around the room and see such a great committee and so much staff support and so much public support for public safety. As someone who's dedicated the better part of 3 decades to public safety, it's near and dear to my heart, and I really love the community I work in, and I think there's definitely improvements I think this committee and likewise everyone in the room can help make. So I see some familiar faces in the room too that have made lots of calls to me on fires and statistics and everything. So Mr. Shaw's Mr. Shaw's
Sit down in the seat for a second.
he never misses an opportunity to talk to me, and I always appreciate the feedback. So, thanks, Mr. Shaw. In terms of just really high overarching, in terms of, I'm going to talk about a couple, some upstream, some downstream initiatives, and then I'm going to go over public safety stats. And I'll give you an overview of that. There'll be time for questions, and we can see what inferences you draw, and I can try to answer your questions as best as I can. So the very first thing, the fire department tries to support the community through response firstly. It's a real downstream. So when there's an emergency, we respond, obviously. And we try to do that very quickly and efficiently. That's one of the biggest objectives in the fire service. And there's a stats slide coming up here that I'll kind of go through what our aspirational benchmark and talk a little bit about the framework that informs that benchmark. And we can explore that some more. Public education is another big initiative for Nanaimo Fire Rescue. So we're really focused on some of our main objectives are fire smart, obviously. We've all heard about the wildfire crisis, mainly in the interior, but we live up against the interface that surrounds us. So it's definitely a main concern for Nanaimo Fire Rescue. We're really trying to strengthen all areas in terms of response, training, equipment in that area too. So as well, we have an emergency manager here that we've recently taken into our department who's keenly focused on that initiative as well. So he can help answer some questions on that too. Fire prevention. So our fire inspectors, our fire prevention officers are out there with our community working really, really hard. It's a smaller group because the fire department, we're always focused on response. I mean, that's the big the shiny object, but our fire prevention staff, a group of 6 people, are out there doing our fire inspections. They're writing all our fire orders. They're working on all our vacant buildings, securing vacant buildings. They're working on homeless encampments, and they work really closely with our building department and our bylaws department on the front end of a lot of potential issues and what could turn into responses for us. So they're a very, very important part of our organization. We rely very heavily on them. And then training. So to facilitate safe response, our department is keenly focused on high-level training. We're one of a department in the province that's lucky enough to have a fire training center here. We've recently, in the last 5 years, really strengthened our live fire training. I'd say we probably have one of the better programs in the province, along with everything we do, from driving to pumping to technical rescue to high-angle rescue to motor vehicle accidents to extrication. That's been a kind of key focus of Nanaimo Fire Rescue. And then lastly, just in terms of resourcing and recruiting, Nanaimo Fire Rescue has been very fortunate to have a supportive management team, community, and council. And recently, we've adopted the first 2 phases of the fire department master plan. So that's a fire department resourcing plan that's intended to provide more efficient, quicker response. It's also in terms of just overall resiliency as our calls go up just naturally as a community. Every year in most communities, it doesn't matter whether you're police, fire, ambulance, naturally the calls go up as population goes up. That's just an outcome of having more people in your community. And to do that, our old model was pretty thin on if we had major emergencies. So I'll just skip to the next slide here and we can talk a little bit more about that. So if we look at our response, these are response, it's an aspirational benchmark. This is the way I'd like to characterize this. So this is based on what's called the National Fire Protection Association Standard 1710. Fire chiefs don't make up all the rules on how fire departments run. We're under a complex framework of the National Fire Code, the Fire Department Act, our bylaws, WCB, and very importantly, the National Fire Protection Association. They codify our response objectives, what's safe and what's not for our firefighters and for our community. So their benchmark for, if you look in the left column, it's in terms of your first in unit, your full alarm, and I'll go into that a little bit further. 60-second turnout for medical incidents, that's getting in the vehicle and driving, and 80 seconds for non-medical. So that's anything that is non-medical. So then we can go into what percentage of calls are medical versus all the other in our next slide. So I'll give you a breakdown of that. And then our dispatch time. So if we look from left to right, you'll see, and I'm actually going to look a little bit farther back in the stats. I'll do a little bit of a summary for you, and I'll do a little explanation here. But if you look at 2019 and incident responses, that was 6,872, moving across to 2023 to 12,089. If you look to the far right column, in October of 2023 was the first phase of our master plan. We're looking at our second phase that's been adopted to implement it in January. So we're actually working towards that as we speak. It's a big process. We're hiring in each phase has 20 firefighters. So you can see just in the short time in 2023 some improvements on the really important one. They're all very important, but one of the main ones is your first unit arrival. So just with the 3 months, we increased 4.4%. So it'll be interesting as we go outwards what that increase looks like, but we're already seeing some gains there. Our 10-minute arrival time for the full company to do the work is always been quite a good standard. And what that would mean is for a structure fire, we send 4 apparatus there, 4 engines with 16 firefighters. That's that full arrival. And that is another NFP objective that we're working towards. At turnout times and on both ends, this is an issue that's really hard to capture for all departments because it's when the person presses the button on the computer. So it's not a fixed variable. So yeah, I'd encourage people to focus on the 6-minute time improving. Because that's where we see, that's when, from the time the call's called out to the time the apparatus gets there, it's the actual, I would call it the most accurate measure, one of the most accurate measures on how we're doing and how we're improving. So I'll just move across here. Fire departments, I think the storybook depiction of fire departments and and what fire departments actually do and actually how busy fire departments are is, I think, two different things really now, at this point in time, at least in Nanaimo it is. So if you look at our, first off, if you look down the left-hand side, this is it's an overarching view of our stats. So if you look in the middle of the chart, it says software change. The reason why we have that is because we have two different databases that the stats are coming from. So I wanted to make that clear. Our new database is more enhanced. Our old database just has a little bit less granular detail. So I'm looking forward to the day when we have 5 days of data. So when we report back 5 years, it's all out of the same database. So just wanted to make that clear. So we're going to have more detail in our new database. In terms of the types of calls we go to, this actually breaks down, if you think of it in a pyramid, I'm just giving you the high level breakdown of it. It breaks down into over 100 categories when we, on the back end, but if we tried to put all 100 categories out there, it would be a real word salad. So fire departments are really the catch-all for all emergencies. If there's an emergency in the community, we're responding to it. So that goes, so if you look at the top, we have our medical calls, which is made up of a number of categories. Currently, we respond to high acuity incidents, so reds and purples for anyone who's familiar with the critical response model. I know someone's very familiar with it. Typically, our low acuity, anything lower than a serious critical emergency, we get paged out if there's a 10-minute delay. So that makes up a smaller amount of our calls, but we do go to some lower acuity when BC Ambulance is unavailable, or it's going to be delayed, not unavailable, sorry. Then we have alarms. We have all the other fires that a lot of them are some of the ones that Mr. Shaw and I have discussed. That we call those fire others. They fall into one basket, and there's there's a telephone pole on fire recently that made the social media that I'm sure everyone saw. That would be a fire that falls into there. Likewise, a Barton fire would fall into there. So that's a basket of calls that has all the miscellaneous calls into it. We have our burning complaints. Those are all the times that people call because their neighbors are burning or could perhaps be an investigation of some sort. We also are the first responders for the initial part of a motor vehicle accident. If there's an investigation or something serious at the incident that needs to be investigated, the RCMP will come out. But for the primary response, quite often we are the people that will deal with the motor vehicle accident. So when we come, we might be the people saying, exchange your information. But we also may be the people cutting you out of the car, or rescuing if your car's in the water, or if it's down a ditch or over an embankment. So it's all the types of motor vehicle. And as the call acuity goes up, and when the call taker takes the call, and there's more significant information in there, we'll start calling out. And likewise, BCIS will be usually paged with us almost all the time. So for motor vehicle accidents. So. We have a miscellaneous category in the first from 2019, but if you look on the bottom right, that's what the miscellaneous category is now. So I've just broken it out. We have structure fires. So those are anything to do with a structure. So it could be your house that's fully, your apartment block that's fully on fire. It could be a building that's, or perhaps even something up against the building. So it's a wide range of different types of fires that involve a building. We do hazmat calls. So if there's a 40,000 liters of fuel, a truck that's turned over, will respond. If it's a chlorine leak or something like that, or chemicals in a curling rink, or chemicals in our water treatment plant, or our pools, will respond. So, or if a business has a hazmat, we've had that too, where they have a hazardous material that's shipped to them because they use it, maybe a mill or a shipping agency. It spills, will respond. So those are significant in their long responses. So again, vehicle fires, assistant calls, rescues entails virtually all rescues in our community are going to be within the city, because we do have also an Nanaimo Search and Rescue that does stuff outside of our city, which we also assist on as well. But that's everything from down an embankment a plane in the water. It's whatever, it could be someone stuck in a pipe, confined space. They're all different types of rescues. So as you can imagine, all of these types of services come with certifications that the firefighters need to train to, going back to that kind of high level of training. Obviously, false alarms, those are just what they are. Mutual aid calls, we also have agreements with our neighboring communities to provide support as needed when they have emergencies. So we don't do that enormous amount, but we have those agreements in place to support each other, but also for the real big emergencies that we all can't handle just by ourselves. And then if down the right-hand side, it's just a further breakdown of the miscellaneous calls. So windstorms, it's wires down everywhere, electrical hazards, we're out there doing that, and so on and so forth. So I just wanted to go over because a lot of people nowadays really aren't that familiar with what fire departments actually are doing. They ask me kind of what you guys do. So it's a large basket of calls, and there's a high degree of training. When I started, if you trained, you just went out and you did the training and wrote it down, that constituted training. That doesn't constitute training anymore. It constitutes dozens or hundreds of hours in each discipline, and we do it every year to make sure our firefighters are fresh and equipped to do the job. Just getting back to our master plan in terms of what we're trying to respond to, there's 3 levels of response. It's low, medium, high. We would like to be able to do all. Our master plan is intended to address the low response, so that's they're big emergencies, but structure fires about 16 people, and then medium size, or the medium hazard is 3-story, like walk-up apartment buildings. Our master plan still doesn't get us fully there for high rises, but it gets us a long way there. And so each phase of our master plan is to look to increase service level across all different types of services and low, medium, and high hazards as per NFPA 1710. In terms of the calls, we did a similar comparison as the RCMP, that the RCMP is a year over year. For us, this is a little bit tricky because in some of the smaller categories, a small change makes a big percentage. But we just wanted to be consistent with the RCMP and kind of provide that. So medical calls, you can see right now are up about 6.84%. Alarms, that's up, but it's a small sample size. Fires, up 7.5. Burning complaints, about even. Motor vehicle accidents down right now. Apparently people are driving a little safer in the first 3 months of the year. Miscellaneous calls, that basket's up. Structure fires up marginally, 3 structure fires, more than this time last year. Hazmat calls is quite a bit up. Another thing I didn't mention about hazmat calls, it could be a vehicle spilling fuel. So we get called to that. That is considered like a small hazardous materials call that we have to deal with. And then vehicle fires is down. When we get to the last bit I have for you, which is dealing with overdoses. So when you look at this is a pretty significant change. I have 2022 into 2023. The lead up to 2022 doesn't have this hockey stick type rise. I heard that saying yesterday, and it just doesn't have that kind of trajectory. It's a pretty generally our calls are pretty consistently grow, and I can speak that a little bit more on it. But so we went from 688 overdoses in 2022 to 1,822 overdoses in 2023. The good news is in our 3-month comparison from 2022 to 2023, to 2024, and I'm not sure if I said that incorrectly on this slide. This is from 23 to 24, 3-month comparison. But on this slide, from 23 to 24, the first 3 months, we are seeing pretty flat. There's really no growth. We're actually a decrease of 2.02%. So I mean, it's a very small sample size. I don't know what to attribute that to exactly. I mean, it's a good discussion for us to be having around this. But in terms of response, we're not seeing that early continued growth like we did in 2023. In terms of our overall trajectory in calls, just something to speak of, because if we go back here to this slide or even this slide, they're both the same. If you look across the top line, you see a big growth, like nearly, no, it's not 100%, but 100% from 2019 to 2023. I'd like to explain that because I think it's important. In 2017, it's going to go down here, because we're only doing a 5-year sample size, so I thought it would just be interesting to kind of look back at stats. In 2017, we went, from 23 to 2017, to give you an example, we grew from 7,019 calls to 9,665 calls. So that's a 38% increase in calls. If you consider from 2017 onwards, that it's actually a 25% increase in overall calls. You see a dip there after 2017. I want to explain the dip to say that if we carried on from 2013 on a normal trajectory, we'd be about where we're at. Actually, technically a little bit higher if we take that 5-year period. That dip in those first 2 years, and then you can see it start to climb back up again. It's attributed to the first one is there was a critical response model in terms of changes in 2018. Happened midway through 2018. Pardon me? Oh, sorry. Critical response model in medical calls. There was a change that the province made in terms of calls that all fire departments experienced. Us, Vancouver, Surrey, it didn't matter who you were. We started to get less medical calls. And that is that first dip that you see. The second dip is COVID. When COVID hit, there was a PPE, a personal protective equipment issue, or a shortage, supply chain issue. At that time, another change was made that restricted the amount of calls we actually went to. So those two combined is that dip right there. Mainly those are the two main reasons for those dips. You can see as when those were removed, they're starting to climb back up again. And in fact, so I just wanted to explain that little dip.
I do have one question for you, because when I look at the medical calls, the total for 2023 is 1856, and the overdose for 1822. So does that mean you only went to 33 calls that were not related to overdoses? Or is there something in your stats? So your stats say the medical calls were 1,856, and then it's this sheet here. And then on your overdose incidents, it said you went to 1,822, so that shows that only 33 calls weren't overdose.
No, this is a 3-month comparison too. So this is full year. These are full year comparisons.
No, but yes, what's that?
No, this is just 3 months.
Okay.
Yeah.
Thank you.
Yeah, no, it's okay. That's an easy, actually.
That's a good thing.
Yeah.
What the hell?
Just so we, I'll get to the slide just so I can clarify what Councilor Armstrong was asking about. This slide right here.
I can't read, they're too small.
Yeah, on the paper, yeah. So what Councilor Armstrong is, okay. Okay, anyways, if we're looking here, what Councilor Armstrong was, this is a 3-month comparison right here. So the first 3 months,
first,
exactly.
Okay,
and then if you go to here, these are full year totals in terms of calls.
Okay, thank you.
Yeah, no problem.
So I'm gonna have to wrap you up. Do we have questions? Because I know, Scott.
The overdose increase is dramatic, right? Is it attributed to the fentanyl in the drugs? Is it correlated with that increase in the toxicity of the drug supply?
I will turn to RCMP more for that question, but I will say that our overdoses, just in general, since 2016, when the province declared a public health emergency, that's where we're seeing massive growth. In terms of this year-over-year growth from 2022 to 2023, would you guys like to?
I know that I'm asking for guesses a little bit there, maybe, but probably.
Yeah, the drug supply, it's worse than it's, the toxic drug supply is hand over hand, year over year, stronger and stronger and stronger.
Yeah.
So it makes sense that individuals will, people accessing the same type of drug and what they believe is the analogs and that are much more powerful. So often that can be, but there can be a lot of different things. There can be people going away from using for a period of time for whatever reason, incarcerated or going into treatment, and then coming back out and then using again and not having that tolerance.
Yes.
So there's a lot of different things that can attribute to a rise in numbers.
It's really
I guess,
interesting.
I just see, they're just such dramatic shifts, like 2022 to 2023. Did you experience those shifts in previous years too, or just sort of?
That's why no, we didn't. We have never experienced it growth like that.
Yeah, because that's a bizarre statistic.
It really-
One question
Well, it's
is, from 2022 to 2023, obviously decrim occurred in the city of Nanaimo. We had some peer-led overdose
Nandu.
prevention sites, Nandu. Could it be that there has been maybe almost a doubling of people using and overdosing? I mean, is that 164% increase, could that be 164% increase of folks using? So then the overdoses would make sense in terms of just an increase in population?
I would be speculating. We're in terms of medical response. We're really focused on our role is to get to. It's a good question because, but the after response statistics we don't have. They're not available to us. So a lot of people when they ask the fire department about medical stats. So when we get a call, it could be happening, right? We do about 5 overdoses a day. When we get to the call, on average, just under 5. If you divide, 1822 by 365, it's between 4 and 5. We get there, we stabilize the patient, we treat the patient, whatever that looks like, airway management, naloxone, and then we will hand them off to BCS and they'll work with us at the incident as well, or we'll work with them. They're really the lead agency on that. And then they'll transport them to the hospital. We don't have the stats after that. So, yeah. So,
And Destiny.
Yeah.
Why don't you go first?
Okay, Destiny.
I just wanted to ask
Good
on the
job,
stats for overdose, if it counts if the fire department attends and has to actually intervene, or does it also count if you get dispatched to an overdose and you attend and the person doesn't actually require medical attention?
These are what. So again, speaking that basket of calls. So when you saw maybe 15 or 20 different types of calls, they get broken down all the way down to about 100 different categories. These are the ones that our officers at the incident attribute to overdoses. So there's an overarching medical call that we get called out to, and then it gets characterized as what's called an actual incident by the dispatcher, and then incident type, and then actual incident type by our officers. And that's what. So if the incident is if they attribute it to overdose, then they check an overdose box. That is how the data is.
Is that even if they don't do anything when they get on scene?
Well, it's because it's a type of call that we go to.
Okay.
So we codify the type of call we responded to. They may not have an intervention, but it will still be attributed to an overdose. Yes.
Kevin?
I was just gonna say, I think some of that stat too probably comes from the fact that the intake call taking changes a little bit, and they make constant changes to what is, calls are coded in different levels, red, green, no, it's irrelevant, but they do make adjustments based on how those calls are coded. And so calls that may have previously been coded as a lower priority in orange, which would still be an emergency response, but might not trigger a Nanaimo fire response, those may now be coded as red calls. And so they're always changing that. So if they say, hey, all of these things that we hear in an intake of a 911 call, now that's actually a red level instead of last year it might have been an orange. So I think that it might not represent a strict increase in the number of incidents. It may reflect a number of incidents that have been differently coded as well. That might be a constant reason.
Yeah, no, it's getting really down into the.
It is. I don't want to go too far, but it could be another reason for that big.
I agree with Kevin. Part of that increase is due to recoding some types of calls. In fact, they just recently have recoded some other types of calls.
Yeah.
Just recently here, so.
Thank you very much, Chief Boyle. Now we've got community safety and well-being, which is Mr. LaBerge, and then Ms. Wood.
Thank you very much. In the discussion, I was thinking of Mark Twain's quote, there's 3 types of lies, damn lies, and statistics.
Leonard Cohen Jr.
But anyways, we've heard so far, our emergency services, our police, our fire department are tremendously busy, and it's getting busier every year. you know, some of the questions that the committee's been asking, what should we be looking at? I think Ms. Wood's presentation is going to give it some really good perspective. We've talked about our downward stream responses. That is our ability to respond to emergencies and to provide services and deal with things as they occur. But that's only a small portion of the work that the city does. We also have a lot of what we call midstream initiatives, meaning how we support our community, particularly our vulnerable populations, and our upstream initiatives, meaning how do we deal with capacity, with prevention, with the determinants of health to prevent things from happening. And I think this will give you a really good framework to start thinking about where we can plug in and make a difference, not only to support our police and fire departments, but also some of the other important work that communities do. So before I introduce Ms. Wood, I was going to introduce our there she is, our new social planner, Emily Notley, who just joined us a couple of months ago. And Evan Lloyd, who Chief Doyle references, our fairly new emergency preparedness coordinator, does a lot of important work with Ms. Wood. So, Christy, I'll turn it over to you. Thank you very much.
Oh, here wants the snaps. Go ahead, Ms. Woods. I need a coffee.
Thanks to the chair and the committee for having me tonight. So as Ms. Woodbridge mentioned, I'm here just to provide a snapshot. Is that better? Just a bit of a snapshot on how the city responds, especially around community safety and well-being programs and initiatives. So I think that when we think about community safety and well-being, we think of our most visible responses. You know, our police, our fire. We've talked a little bit about community safety officers as well. But it's important to note that the city does have some impact on some of the root causes of crime and social disorder. For instance, you know, some of the examples that we can think of are, you know, the design of our built environment in our public places, or the provision of community amenities like parks, or other things like city programs, initiatives that support social development, recreation, culture, and wellness. And I just want to say that the summary before the committee today, it's important to note that not all services that the city provides related to general safety are on that document. For instance, we have some great work being done by our engineering and transportation to enhance road safety as well. So I just want to put that out there and let you know that this document is really meant to focus in on programs and services that are more related to crime, social disorder, and community well-being as well. The committee will also see that the overview is also structured, as Mr. LaBerge said, in 3 categories. So you've got your downstream, midstream, and upstream. And that's just really to try to organize the different types of impact that they will have on community safety and well-being. So I'm just going to provide a brief overview of some of the things that we're doing within the city, but we definitely have lots of staff in here tonight that can maybe answer some questions or details about some of the programs if you have any questions about that as well. So I'm just going to start with upstream approaches. So upstream approaches to community safety and well-being are all about creating environments where we don't need the midstream and downstream approaches. So that's about creating communities where everybody has equal opportunity to grow, work, play, have a sense of belonging. Protective factors that we often talk about are positive social skills, strong relationships, access to recreational activities, volunteering, or as Mr. LaBerge mentioned, the social determinant of health indicators such as housing, employment, education, all create an environment that reduces crime and victimization. So before I go to the next slide, I also want to mention, it's not on the slides here, but a lot of this upstream programs and works that I'm going to touch upon, this work is also reflected in the goals and policies that were recently adopted through City Plan. So the first one is our housing initiatives. I'm sure you've heard lots of activity in the news about some of the changes that are happening in the provincial government. So the city works hard to ensure that Nanaimo has a different range of housing options for all different types of income levels. And right now in 2024, our planning and development department is working hard in response to the new provincial legislation recently announced. And this includes a short-term rental review, small-scale multi-unit housing, and transit-oriented areas to support densification. More detailed information is in that handout, and the handout also does have live links, so you're welcome to click on them to get a little bit more information. And you will, if you like following council meetings, you'll hear a lot from staff that will be bringing forward more information about that as well. In response also to city plan that I mentioned before and the community's desire to increase affordable housing, they've already been working on increasing that rental stock and diversity, encouraging gentle infill and intensification in existing neighborhoods, and also encouraging family-friendly and adaptable units and multi-unit developments as well. The city works closely with BC Housing. In 2019, many of you might know that the city signed an MOU, so a memorandum of understanding, to create more than 300 new homes, and that included 3 affordable rental housing developments with approximately 125 homes for people with low to moderate incomes and 4 supportive housing developments with approximately 190 homes for people experiencing or at risk of homelessness in the community. The city is ongoing, working with BC Housing to secure more units, including some additional emergency shelter beds as well. We mentioned earlier, the chair mentioned earlier, all the hard work that mayor and council do, and as well as city staff to advocate for services in Nanaimo, and that includes with BC Housing and our health partners as well, to secure units, like I said, with emergency shelter, but also working on a navigation center and the recently announced addition of the 20 complex care beds. Another piece that's really important in the upstream work is, how do we prevent people from coming into homelessness? And so in 2020, the city worked with community partners to establish the Nanaimo Region Rent Bank. So that's currently being administered by Connective Society. And that program is an eviction prevention program. So it provides forgivable loans to people who may be facing a short-term crisis and they aren't able to pay their rent or they need help paying utilities. So that tries to help, prevent them from falling into the homelessness. And we know, if anybody has kind of learned about the Homeless Point of Time count, that when people do fall into homelessness, it's really hard to get them back. Rent supplements, on the other hand, are more about creating affordable units within market rental. So it really tries to bridge the gap about what they can afford to pay and what the actual cost of rent is. So it's a bit of a faster way of creating affordable units in that way. So they in 2023, council dedicated $225,000 towards the rent bank and rent supplements, and an additional $200,000 has been allocated for 2024 to support those programs as well. And we will be coming in the coming weeks with an update to council about the rent bank. So if you're interested in learning about some of the stats and the different the families that have been supported through there, please stay tuned. So somebody, APP for police, they mentioned youth and gang violence. So in 2022, the city was notified by Public Safety Canada that we were allocated $1.8 million to address gun and gang violence within the city. And the purpose of the funding is really upstream. It's meant to focus on the addressing root causes that might negatively influence a young person to become involved. So we did hear a lot as part of building some of that strategy. Kids coming home with those fancy runners that for some reason they couldn't afford to do. So for the first year of the funding, we built a multi-sector steering committee. So it's sector reps from all different types of agencies and partners within the city to develop a strategy. And that strategy really focuses on where there are gaps in supports for youth at risk. And then that actually helped us guide where we wanted to distribute the funding. So the next 3 years, right now, we're funding 8 different programs within the city to support youth at risk. And I should mention, with Public Safety Canada, it's only 3-year funding, but through the work of the steering committee, they actually supported Snuneymuxw First Nations and Port Lalem to submit a Foundry application, and they were successful in their application. So that means that the sustainability of this work that we've started can continue on through the Foundry. So as I mentioned earlier in my introduction, that there's links between community involvements in parks, recreation, and culture programs are associated with lower levels of crime and vandalism. Our city's Parks, Recreation, and Culture Division supports upstream initiatives by providing safe gathering spaces for families and individuals and youth, programs and events for a diverse group of people, regardless of age and demographics and economic status. One of the other initiatives that you might have heard about is called our Leisure Economic Access Pass, so the LEAP Pass, and that ensures families who face financial hardship can access recreation and positive development programs for themselves and their children, and so that's really important. The other thing I want to note too is that they are also our frontline staff, and so they often will come across people who are in need, and they can actually help with navigation services and connect people to services as well. Our social planning grants assist organizations here locally in the city of Nanaimo to respond to social issues and supports programs that enhances social cohesion, addresses the root causes and effects of poverty, and contributes to the vitality of the community. So each year, the city allocates $85,000 to support these programs as well. And finally, under the upstream initiatives, in 2022, many of you will know that Council adopted a neighborhood association supports policy and has committed $10,000 annually through a grant program. So neighborhood associations can apply to that grant to get support. And yeah, go ahead.
Is that $10,000 per neighborhood association?
No, just
all of that.
yeah, and so that is really, I mean, our neighborhood associations can also apply for, we have a lot of different city grants, but that's really just to help them with some of the administration functions and stuff that is hard for them to do on a volunteer basis. And I just bring that up because, as you know, our neighborhood associations are so important. They are kind of the front line. They see what's happening. They are also the ones looking out for residents and community members as well. They also, I know in my past role as community policing coordinator, they were the ones that brought safety issues forward. So definitely play a very important role in some of that upstream work. And of course, you know, when we have neighborhood associations having really good positive events and bring people out, that helps create safety within a neighborhood as well. So our midstream approaches incorporate more prevention and risk intervention strategies. So I'd say they're more targeted. So when I talked about youth at risk, they're really focusing on those populations, that segment of population that can kind of fall into needing downstream responses. So trying to decrease the risk, the likelihood of victimization and trauma as well. So our Health and Housing Action Plan, that's a midstream approach that provides a 5-year roadmap to support those at need who are facing vulnerable circumstances to meet health and housing needs. So the newly established Nanaimo Systems Planning Organization will help to implement this Health and Housing Action Plan. Their role is to look at providing research, data, analysis, education, and coordination to improve the community's response. So the city's providing the Nanaimo SPO $480,000 annually for 5 years to do that work. The Community Policing Program is a city-funded program in partnership with the Nanaimo RCMP. And the program provides so many great, cool crime prevention programs. They offer neighborhood safety audits, which I see some folks in the room that have participated in as well. They do a crime watch program, a speed watch program, a bike theft prevention, and other additional safety campaigns, and has a pretty robust volunteer program as well. And the Nanaimo Acute Response Table, aka Situation Table, you might have heard of that one before. The table held its first meeting on January 31st, 2023, and the city actually received provincial support to help with the training. The unique thing about the table is it brings together frontline professionals, and they triage. So they proactively try to address risk where there's acutely elevated risk. So that includes like high-risk situations that could be like victimization, somebody who's at risk of criminal offending maybe, or they're about to face an eviction, and without immediate supports would maybe face life-threatening or some serious consequences in their life. So the idea is that these team of professionals that sit at this table offer support services within 24 to 48 hours. So we've had 37 referrals to the table so far since that time. We have about 25 different agencies at the table, including Community Corrections, we have RCMP, all the various ministries at the table as well. And I gotta say, pretty proud of the work that they're doing there, and some of the success stories that they have been great. The secondary piece about the table that I think that will be of interest to the Public Safety Committee is that as time goes on, we do collect de-identified information. So we're in the process of creating a bit of a dashboard. And so we do collect specific risks that are happening locally. So we'll be able to kind of provide that picture. And we're one of other 33 situation tables in the province as well. And we have been told by some of the ministries that they will be looking to that data when they're looking at how they're investing or making policy decisions as well. And the downstream initiatives, as you know, I mentioned, those are mostly associated with our fire and police services, our bylaw as well. They are really meant to respond to critical emergencies, requires immediate response, and also holds individuals accountable where appropriate. Oh, what did I just do? Did I do that? Perfect. Yeah. So Heart and Heart, that was just a recent announcement that came out at the end of January. So the city's entered into another MOU with BC Housing to participate, and I'm going to read the acronym out to you so you can kind of understand what it says. So the Homeless Encampment Action Response Team and the Homeless Encampment Action Response Temporary Housing Programs, so Heart and Hearth. And work right now is underway to develop a terms of reference that will guide the HEART team. The HEART team is going to be a group of frontline professionals who will help connect people who are experiencing homelessness to shelters. And BC Housing, as many of you might have also heard, have just recently announced the two HEART sites, both at 250 Terminal and 1300 Island Highway South, and each will provide 50 housing spaces for individuals. That the idea is for them to free up some. They'll be taking people from shelters and free up some of that, so that way other people can have access to our shelters. Our Downtown Nanaimo Community Safety Action Plan, I won't go too much in this. Mr. LaBerge has talked a little bit about that. It was developed in 2022. So since that time, the city and our bylaw department has done quite a bit of work around there. They've hired 12 community safety officers. They have 2 clean teams. They supported additional downtown parkade cleaning. They implemented a vandalism relief grant, which some of you know about as well. And they're working to implement additional parkade security, as well as doing some SEPTED improvements to the downtown core and establishing an ambassador program as well. So in the coming weeks, you should see a little bit of an evaluation of that, of the action plan, and feasibility of expansion and making sure it's aligned with some of our other strategies that we're working on. And I should mention that the Public Safety and Solicitor General provided $75,000 for us to be able to do that evaluation through that work. Warming centers.
I believe that I heard you mention something about a navigation center. Mm-hmm. Is that in addition to the Heart and Heart, or is that?
Yes.
So that's not they're not, okay.
Yeah.
Can you speak to that?
Maybe Mr. Holm can speak if there's been any updates around the navigation center.
Still in the works.
Yeah.
Yes.
But it's
Going for 5 years.
Mm-hmm. Yeah.
We've been able to get a location.
Okay.
It's progressing, and we should hear something from an announcement on that this year. Is my expectation. I can't say when exactly.
Has to come out of the province. We're not allowed to speak. It has to be the province. Okay.
Why does it take us long to get a location?
Why has it taken so long? No sites, suitable sites.
Okay, and I remember at the last meeting, guys, there was mention about the warming centers, so just maybe touch a little bit about that work. Warming centers in extreme weather response. So in order for the city to do that, we actually work really closely within various city departments. So that includes our planning and development, our fire, parks, recreation, and culture, and our public safety department. We also work closely with community partners. And so this year, we were able to provide supports and services for general daytime warming and for extreme cold weather events this past season. So over this past season, the city allocated almost $500,000 to fund the 3 daytime warming centers. Many of you probably know, operated by Island Crisis Care Society, Rise Ridge, and the 710 Club Society. Having these established daytime warming centers actually allowed us to really respond effectively when we had that 1 week of really cold, extreme weather. And our Mr. Lloyd, our emergency program manager, was able to access emergency management and climate readiness funds
To be able to support the expansion of that in order to get people outside, inside, and save lives, because we had some really cold temperatures at that time. And I should note that there will be a summary report coming to council in the coming weeks about that as well, so if you're interested in more details. So in 2018, due to limited shower services and hygiene services, the city started funding a shower program in partnership with the Unitarian. So currently the program runs 5 days per week down at Caledonia Park. And I think many of you also know, I see some service providers in the room, that it also acts as a focal point to connect people who are experiencing homelessness to other services as well. Police, you know, we've had Inspector Burton talk, but I think I should also just mention that council made some significant investments with RCMP. So they supported the addition of 4 downtown safety officers. Those have transitioned to support the Revoid program that Inspector Burton is talking about, and some good successes throughout the province on that to target violent repeat offenders. And I think I should also mention that there are enhancements to our RCMP bike unit, which probably many of you guys have seen out there on the road.
We'll just add in 50 more police officers.
That was gonna be my last line, you stole it.
Well, I'm just conscious of the time.
Oh, yeah,
because
sure.
we're only up to
Yeah,
6.
I'll go right in
We've
there.
got delegations waiting, we're not gonna get through everything.
Yeah,
so.
no problem. Yeah, and so I'll skip over fire because Chief Doyle already did that, if that's okay, just for time. And then the breakfast meal program, the city's no longer funding that, but I just want to mention that the city has taken quite a role around provincial mandates to be able to step up to do some bridge funding. And so there's been times where there hasn't been a meal program being provided, and the city's been able to provide it either through city funds or applying for different grants to be able to provide that as well. And lastly, our Surviving in Nanaimo Guide is an online tool for anybody who's looking for any kind of help around services, so housing, food security, clothing, or anything like that. And we update that through our program as well and try to keep it up. But it's an online tool as well. So hopefully,
Questions?
Any questions? Okay.
Not seeing any, thank you very much. And Ms. Wood and Mr. LeBears are always available for this committee, so we're doing great work. I want to thank you very much for that. We're going to go to delegations, because we are short on time, and I'd like to welcome Ms. Echo McNaughton to the podium, I allow coffee. We don't follow it out, so I'm okay. So we're having a presentation on improving pedestrian safety in the South End.
Because I bet people are hungry. Can you hear me? Yeah, okay. I did have a, oh.
No, it's.
Yeah, we think the battery might have,
Okay, I'll use my teacher voice.
yeah, very loud.
And I've heard from the live stream that they've heard that it's a bit quiet, so I'm Echo. I live in the South End. And hope I know how things work, because I'm used to using a space bar. Don't give you this at school. All right, this is where we call home. Our close-knit neighborhood is the kind of community spirit people dream of. It's the place where people show up for one another. We're an old neighborhood, and you see it in our infrastructure. Homes here are affordable by Nanaimo standards. Many young families are moving here, and we are growing. Advocacy is hard, because people are busy just trying to put food on the table. We're rich in community, but not in wealth. Nickel is part of the Trans-Canada Highway. Many families live a few short blocks from the school, but don't walk because of how unsafe the crossing is. Last winter, the crossing guard at this intersection was hit by a car and had both of her legs broken. She told me she had many close calls before this incident. This crossing needs to be made safer so this doesn't happen again and never to a child. Many neighbors have reported having almost been in an accident in this intersection. The eastbound stop on Needham is difficult to see when traveling southbound on Victoria. Living close to this intersection, I see and have been in many near misses. We'd like to see View Street closed off once Victoria Road is repaired. In line with the South End plan approved by the city, this would allow the crosswalk and stop sign on Needham to be moved up for better visibility. There are no sidewalks on the west side of Bayview. Students traveling along this side must walk on the shoulder or on the road to get around parked cars. This area is slippery in the winter and there are regular close calls between students and vehicles. The neighbors in this community have been asking for sidewalks, usually for as long as they have lived in the area. We have emails to back it up. Over and over again, when we talk about problems we are experiencing in regard to pedestrian and road safety, we get two responses from the city. One is that they've done a study on the issue and they tell us it's not actually a problem. The speeding isn't that bad, there aren't that many accidents. What's missed is the element not captured in the study, that most of the accidents are near misses. That there are no sidewalks in many places, so while the speeding may not meet their threshold for action, try walking next to a car going that speed with nowhere safe to go. The second thing we've heard is the best way to get improvements is to pair it with utility upgrades, as this makes financial sense. Many of the neighbors who've been doing this advocacy have heard this and tried to put their trust in the process and be patient. The other option to get upgraded infrastructure is redevelopment, tearing down the old to bring in the new. While new projects are welcome, our only hope can't be that our neighborhood gets torn down and redeveloped before we get the basic infrastructure many other parts in Nanaimo takes for granted. Can you see this letter? Okay. The school has spoken with the city about upcoming planned upgrades on Bing Heath, Columbia, Princess, and Needham Street. When they brought up the need for sidewalks and better crossing for student safety, a member of city staff dismissed the needs of the school. Yeah, everyone wants that, but it's not going to happen. Our concern is if sidewalks do not happen with the May upgrades, that it will be decades before there is significant work happening in this part of the city again, in which these add-ons can be paired. In 2010, the city adopted the South End Neighborhood Plan. Taxpayers have funded the work of this plan 14 years ago. Many of the changes we are suggesting are outlined in this plan, which was approved by council. We would like to see it implemented as soon as possible. Otherwise, the taxpayer money spent on this plan was a waste. There we go. Last year, the South End Community Association asked to bring 3 easily actionable initiatives they wanted to see to the City Neighborhood Association meeting. One was prioritizing pedestrian safety, improvements specifically at Nickel and Needham. The city recently sent an update on the progress made so far. There is none.
I can just move it for
Our homes are some of the oldest in Nanaimo. People have been paying taxes to the city longer than many other areas. But what do we have to show for it? People from the South End regularly point out the discrepancy between the infrastructure in the North End and that in the South End. Every single person I've spoken to about these issues is beyond frustrated. People feel ignored, that their concerns are not worth the city's attention, and that our neighborhood is not a priority. We would like A motion that this committee recommend to the council to allocate funds for sidewalks with the planned upgrades scheduled for this May around Bayview School. Sidewalks in our neighborhood with any planned projects. Solutions that encourage drivers to slow down and to see pedestrians. Quarterly communications between the city and the South End Community Association about progress on these initiatives. In their campaign for city council positions, a majority of councillors included improved pedestrian infrastructure as part of their platform. We have already have the plans approved and paid for. The school, businesses, and community are in support of the changes. What we need now is funding and a will to implement these solutions. Everyone deserves a safe walk to school.
Perfect timing. Thank you. Questions from the committee? Judge Cohen?
Ms. McNaughton, I was by there the other day and I was sort of really amazed at the lack of a sidewalk by Bayview. And it would sort of hope that the city would have a priority program that in the vicinity of every school, you know, for at least a certain radius, there was sidewalks or something similar. But also, it looked like in the community plan schematic that you put up there, that there was a plan for a roundabout at that intersection of Needham and Victoria, and it would seem to lend itself to that. Would the district association be in favor of that, or not see it as a positive thing?
So when I've spoken to the city before, that particular intersection does not meet the threshold for width in all directions to put a roundabout in there, and it doesn't work with the truck route that is currently there. Part of that South End plan talks about making Victoria Road no longer part of the truck route. It's actually a painted mandala in their plan there, which would be lovely, and the community is all for some art-based solutions that would just get drivers to visually look and slow down just a little bit, and then just bring Needham up so that it's a four-way stop instead of a five-way stop.
I'm surprised about that, because if you drove down Lost Lake Road, you'd see all sorts of things, you know, including speed bumps and a roundabout of sorts, and it would, anyways, that's.
Any other questions for the delegation, and then we can ask, I'm gonna ask staff to clarify some stuff, because there are some answers to some of the questions. Jennifer?
Oh,
thank you.
Thanks. Thanks, Ms. McNaughton for your presentation, and I just have, it's more of a comment. I'm aware of what Councillor Armstrong said about trying to make sure that we didn't just solely focus on downtown issues, but I see in this case, some of your suggestions, Ms. McNaughton, are maybe going to be, you know, preventative of some of the things that that we've been looking at with respect to downtown crime and drug use. From my perspective, it makes sense to promote and encourage, you know, other positive types of traffic and positive types of safety initiatives in a neighborhood that might be sort of on the fringes of some of the negative drug-related crime and kind of decay issues that we're looking at. So I see this as being more important even than just the issues that you've rightly raised about promoting safety and keeping school kids safe.
Thank you. Thank you very much, Echo. And I'm going to turn to staff now. I know we do have a priority system, and I'm going to ask Mr. Rose probably to speak to it so that you understand the system that is used by the city. I do want to say that last year the city did raise from $300,000 to $1 million for sidewalk improvements. Wasn't done this year, but it's something we're certainly going to look at in next budget cycle. Mr. Rose?
Yeah, so specifically in regards to how we identify and prioritize our investment in pedestrian prioritization, we've gone through a process through city plan to discuss with the community ways and values that we then use to vet locations, excuse me, because we just fundamentally do not have the capacity to do everything everywhere that we want to do. And so a lot of the values that are in that are fairly straightforward: speeds, volumes, collision history. There's also factors included to account for pedestrian demand, proximity to schools, things of that nature. And so I had a quick look just before tonight and had a look at all of the crosswalks. And by the way, that tool has enabled us to look at all of the crosswalks, all of the marked crosswalks in the city. And so I had a look just before coming to this meeting, and the crosswalks in your neighborhood, with the exception of Nickel, are in the sort of medium category. And so, as Councillor Armstrong mentioned, there's an annual program which has a base value of about $300,000. But council has quite aggressively increased it a number of times over the last few years, up to $1 million. And so we go through this process, identify sort of the next projects on that list, and then cross-reference them to existing projects and say, sort of categorize them, going, okay, this fits here, or this is a standalone, and we do need to identify this as a recommended location for the project, for the annual investment. And so, so we bring these reports to council typically late spring, early summer, identify a number of locations that we feel are worth consideration. One of the things that we have consistently talked about through those reports is prioritization of investments at intersections as opposed to sidewalks. Intersections are by far the highest point of conflict. That's where the vast majority of the collisions do take place when they happen. And so that tends to be where we recommend focusing our investments. Not to say that we have not used this money for sidewalks. There's a number of locations I can think of. Just recently, we ran the 2023 program. It was determined that the sidewalk in Berkshire Bay was preferable over a couple of crossing locations. And so we do have a fairly formalized and rigorous process for identifying locations. Another stream that feeds into that conversation is our active school travel program. Not sure how many people are aware of it, but Bayview did have a program that was developed back in the mid-2000s. I can't explicitly remember whether it's 05 or 06, but that process actually triggered several infrastructure upgrades around the school already. So it dealt with the traffic right along the frontage. It also included a crosswalk on 5th Street at Princess, as well as some sidewalk and shoulder and then trail connections down from the school down to Raynor, and then across Binky across Raynor to the Binky rail crossing. So there are a number of things that did trigger and could be brought forward through another updated plan. So.
Could you also speak as to the cost of what it costs for sidewalk per meter compared to what it was?
Yeah, so the cost for sidewalk is continually escalating. Not that long ago, it was a couple $100 a meter. It's escalated to well north of $1,500, in most cases closer to $2,000 or $2,500 per lineal meter. And I do need to acknowledge we did look at including sidewalk in the utility program that's going on this year. Unfortunately, there is no storm infrastructure in that neighborhood, and so what that means is that in addition to the $2,000 to $3,000 or $2,000 to $2,500 per lineal meter for sidewalk, there would also be a necessity of storm infrastructure, which is also in the neighborhood of $2,000 a lineal meter. So that now puts the sidewalk at a total value of closer to $4,000 per lineal meter. And so at the time, and even if we were to go back and have the exact same conversations, we do not have the capacity to do that sort of investment at this time. So it's unfortunate, and it's not something we want to pass up on anytime we can, but it's just an unfortunate reality.
Judge Cowan?
No, just a comment.
I'm sorry, it's just habit of years.
I understand the cost of sidewalks, but when I drove by there was barely a shoulder. And if you look at Departure Bay School, they have a paved shoulder and they have the pylons up, which offers at least some protection. So it sounds like they're a long way away from the storm renewal and the sidewalks, but can't something be done in the interim?
There's always opportunities to implement things like that. I don't remember the explicit width of the pavement. I have this feeling that it's quite narrow to start with. And so there may be an opportunity to do some additional paving with the utility work. I also don't remember which side of the street.
I'm talking Departure Bay.
No, sorry, associated with Bayview.
Yes, that's Bayview's the problem, Departure
Yeah.
Bay was one possible
Yeah.
solution.
Yeah. So there is a possibility of including something along those lines. So we can certainly take that back and reconsider it, but as I say, the notion of sidewalk is quite a significant investment.
Not too much,
Yeah, we can't go much past 6, but a recommendation that I see, and I'll let Councillor Eastmere as well, is it might be even a recommendation from this committee to increase the pedestrian fund from 300,000 back up to $1 million, something like that.
I don't know the specifics, but can I speak just
Of course,
quickly?
go ahead.
First of all, I think that was a great presentation, so I think that was awesome, and I think it speaks to a lot of stuff. I've had a similar email and response exchange with the city, so I feel your pain, right? Like I get you, and you know, we're not allowed to go buy our own concrete, do our own things apparently, so don't do that. But I'd love to make the motion to support them. Cognizant of the fact that every other association and communities all over the town will have the same concern. I don't know how to reconcile those two things, but I'm happy to put forward a motion to not make you walk away empty-handed from this committee. I think we need to be action-oriented. We can't just sit around and chat about stuff for a year either. So if that motion is appropriate to council, I don't know the money, I'd be happy to make the motion to look at increasing the funding if that will lead to some sort of change in the future.
I'm going to look to Ms. Gurry. We have the motion that has been asked for by South.
yeah, so.
So we could, I think that.
So you could.
I need to see it again. I was gonna make that, but
So,
I
yeah,
don't
Ms.
recall
Gurry's got it,
what
so you
said.
can just make the motion that was requested by the South Indian
Yeah, and
Association.
I'm happy to support that.
There it is,
If
right
it's,
there, so, and if it's seconded, then you can,
Do I have a seconder for that motion? Seconded by Kim, discussion. Councillor Eastmere?
Well, so the motion is for funds for sidewalks. I wasn't clear on the whole storm infrastructure needing to be part of the sidewalks. I guess I don't understand that. It's because of water that collects on the road if you have curbs.
Exactly that. And so if you build a sidewalk, now you're creating a.
So if we looked at doing the paved shoulder with the bollards, could that potentially?
That's as Jane indicated, that's
So
something we
let's
can
look
take.
at options then.
Yeah.
To allow for options for sidewalks, or options for children to walk safely to school. How about options for children to walk safely to school instead of a sidewalk? Is that? Okay.
I mean, you'd have to take it back and wordsmith the motion, I
Like
think,
do
to be super
sidewalk
appropriate,
or
but.
other
pedestrian,
options.
pedestrian safety initiatives,
Yeah.
for the, Bayview School area.
I trust Ms. Gurry to come up with the right one, if you do.
Oh, I don't know her that well. But yeah, sure, I'll give her the benefit of the doubt, yeah.
She'll
Sounds
capture
good.
the motion that we want to have pedestrian improvements to Bayview School.
Yeah, I think that sounds great, yeah.
And we could, and that may include upping the pedestrian allocation budget.
Yeah.
I would like that added in, just so that the community recognizes 300,000 after you heard it's $2,000 just for that. Doesn't take much
Everybody
to
here
know
would
it.
certainly rather prevent a pedestrian truck than go to one, so.
The other thing I just wanted to mention fast too, like one of the issues on Nickel Street, it belongs to the Ministry of Transportation and Infrastructure and we don't have any control over that. However, there is a working group that works with them regularly that can keep bringing these issues forwards.
But that has been several times too,
Yes.
so we've heard it from.
I did have one question in regards to the person who was struck, the crosswalk.
Well, let's take the motion and
I just,
we can
oh, I'm
do
sorry.
that, yeah. So, any other discussion on the motion? Seeing none, call the question, all in favor? I can't see Jennifer. Are you in favor, Jennifer? Yeah, in favor, I see her. None opposed, motion carries. Ruth?
So is there a crossing guard at this time, since that person?
That's the school district.
That's this, but does anyone know, is there a crossing guard at this time?
Yes.
There's another
She goes
person.
down every morning and every afternoon.
Just Chair, just to clarify, so it's a motion for, the committee recommends that council support or council consider options for additional funding for pedestrian safety improvements near Bayview School.
Perfect. Is that okay?
It is, I'd also like to include the, I think it was the last part that says, I
Oh,
wanna
and
hear back
reporting
about.
back to the community.
Reporting back to the
Reporting
community,
back to
like, or-
Sika?
Yeah.
Yeah, quarterly, I believe.
Yeah, actually, for my motion, I'd like to hear it back in our next scheduled
Oh,
meeting
yeah,
and see
quarterly, and then,
hear back
which
there.
is basically almost quarterly.
Yeah,
But we may have semesters. Cognizant of the time,
Yes, so, Chair, I was going to suggest the last item is, more of a committee work plan roundtable, and a lot of folks need to go have dinner, et cetera.
so we can bring that
So, or
Can we
what the
schedule another
committee
meeting?
members could do is they could email in their ideas. We have attached to the agenda, committee members' ideas and things that they would like to see, that we could attach to the next agenda and then have a conversation with everybody's input. And or we could look at scheduling an extra additional meeting. However, with this time of year, budget meetings are quite significant in this month and next month. So I would
yeah, we can
suggest
do it next meeting. Is everybody okay with that, sending your ideas into that? You've got our
of what you
email.
would like to the committee.
So is that our 5 to 10 priorities, is that what you're talking about?
Yes, if you could, so one committee member already has and it's attached. If you could all send in your 5 to 10 priorities that you would like this committee to focus on, then at the next meeting, you could all have that discussion and workshop those
And I
ideas.
think we have to pick the top 3 priorities because we can get so extended, right?
100%, like 10 would be too much, 5 might be.
Can I
Scott?
suggest less than 10 then? Maybe we should
Yeah.
try and prioritize?
Seven?
I would say
Top
5.
2 each or something?
Okay, 5, let's look at 5 to see if there's an overlap.
And we're gonna have 50 different ideas
You might
to
have
filter through.
what we find when we do ours, you'll see there's a huge overlap and it doesn't
Okay.
take long to pick, well,
Okay, sure.
there, 5 will stand out at you really fast.
Wonderful.
I can already tell you what they are, I can already know them, I'm
Oh
100%
no,
sure.
I've got great ideas.
Well, that's good, I hope so, I would love to see that.
can we extend?
Mr. Sims?
Yeah, just briefly, on the, under the committee
No,
work
I
plan,
mean,
you have a list. A lot of them are from Doug on traffic issues, and we're proposing probably at the next session to have a basic transportation 101. Jamie gave you a really smattering overview of a few of the things. I think it warrants a greater discussion, but I think Jamie can do that at the next meeting.
Kim?
Can that include the bike lanes and such?
Yes,
Because I had
whatever
an
you want.
experience in Victoria and I was confused when I was trying to turn right. And then the bike lanes are right there, so
There's
just,
lots of issues.
yeah, so if that's to do with road safety, which it is, we can put that in there too, that's, I'm not even a biker, I'm not concerned with that, I don't want to hit one.
And when's our next meeting, Ms. Curry? Do you have the calendar handy or now?
May 12th or something?
Well, you guys are ahead of me.
Can it be longer? Or would that require a
Are
motion?
we allowed to do longer, Ms. Curry? Because I do
They
think,
are set for the 2 hours, and that is for scheduling staff as well as people to have dinner, et cetera. We could look at least, maybe starting it at 3.
what about,
But then 3 hours is a little long to go without a break.
could we add a meeting in June or July?
So June 12th is our next meeting.
June
We don't
12th?
meet-
We don't, is it possible to put a meeting in July so we have 2, like June and then July? Because we take off all
We
August,
have
right?
the advisory committee on accessibility and
That's right.
inclusiveness in July, and July is a very heavy month due to the August break. I think we have 16 meetings in July. Like,
If we could just extend the meeting that's coming, I think that if we actually had a roundtable, that's an hour of probably good,
Easily.
arguably heated discussion that'll be a lot of fun and probably more useful,
Are
I think.
people able to come at 3?
I can, it's a work day, so I don't care. Do it.
Is there an issue with 3 for anybody? Are we able to do that, Ms. Curry, to start at 3 and then we could go, and then if we're,
Just for June 12th.
yes, just for the June 12th, just so we can really have the time to really sink in what your focus is gonna be.
Yeah, if that's gonna be the last meeting before September, right?
Yeah, so let's focus so that when we come back, we know what our priorities are starting in September. We'll pick a priority to start with.
It sucks being rushed, right? You wanna have some.
No, I know, it's like,
I
yeah.
mean, I thought the presentations, they were awesome.
Yeah.
Like, I think that's a really good.
Madam Chair, before you call the meeting, I know we're looking at time
Question
here.
period, yes.
Yeah,
Yeah,
quick
yes.
questions.
Yeah, not to worry.
Okay, Andrew, if I could talk to you after or tomorrow or
So-
something, I'll skip Andrew.
We have no motions on the table, so now I will go to question period. Mr. Shaw, you can speak from there.
Chief Doyle? Question is, thanks always for our conversations, much appreciated. In your itemization, you say increases in medical calls for overdoses. Now, the other fires that we talk about a lot, they've also increased. And I see a lot, unfortunately, in my area from those that are living on the streets due to depression possibly, or definitely from drug use. So is that what you're seeing?
Certainly, yeah, that's exactly, it is definitely a main concern.
Right, and then what about the second question for you, and then one question, two questions for Chrissy. When I call 911 and I report something, let's just say it's like the hydro pole on fire, etc. Dispatch, usually 911, will dispatch fire and I say, I would like police to attend to identify the person that is still right there and I can point to. They say, no, we're gonna dispatch, it's a fire call, we're dispatching fire, and I said, I need the police there. What can we come to on that and balancing that out? And if Andrew wants to jump in here quickly, fine as well.
I can answer the first part, but I think shift to Andrew.
Okay.
We'll just do it very, very quickly. Sorry. Is that?
Well, it's supposed to be committee questions and then,
I thought it was, wasn't it in here to the,
no, it goes to the committee and then we
okay.
decide where it goes. But I
okay.
was gonna send it to Chief Doyle anyway.
Okay, I'll ask you, Chair.
No, it goes to Chief Doyle.
Okay, I'll just quickly answer. So a lot of confusion about 911. Your initial call goes to Ecom. That's the intake, the call center that takes everyone's 911 calls. Then, depending on your region, if your region uses Ecom, they send it over to their other Ecom people to send it out to the resources in that community. In our case, for fire, it goes to Surrey. In terms of police, it goes to Comox, Courtney. And yeah, I can't remember the exact title of that center, but so that's how it works. In terms of the call matrixing, they have a matrix, basically you answer the question and it goes to that agency. So to answer your question on how to get it to both agencies in terms of that call, I'd have to look into it for you. I can dig deeper on that. I don't know if there's
Andrew?
Yeah, I think it's on a call-by-call basis, and Chief Doyle's correct, Mr. Shaw, with regards to how the call is generated, where it goes to, based on which service would be coming in. I'm disappointed to hear that. I mean, I would think that could be considered an arson, which would be a police matter, which would likely entail both the police and fire response. I can't speak specifically to that instant, but I'd certainly I can follow up with our OCC, well, Ecom initially and then the OCC.
I'm gonna let Chief Doyle follow up because it is started with an Ecom if he's okay.
Yeah,
And then you guys can liaise.
I can follow up with Ecom on that question.
So through the chair, last thing, yeah, I think that the RCMP should be there as well to identify these people before it escalates into bigger fires or more fires from that suspect that I or others have seen.
Yeah, we'll do
That's
the
not
follow-up, Mr. Shaw, we'll do the follow-up for
Thank
that.
you, okay.
Any other questions?
Yeah, quick question, Chair, if I may, from Christy Wood.
What can you say to the chair, then I'll decide where it
Okay, I'll
goes,
say
please.
that the point in time count that was released here from last April, but just released at council on Monday, one of the points was that 30% plus of the people that are homeless say they were evicted or cannot rent because of their looks, etc., whatever. But I'm wondering, is that because, Chair, because the people have either been kicked out of a place for doing damage? Is that part of that figure?
We can't answer that because that question was asked at the meeting and he doesn't know that answer. That wasn't something that they looked at further. There is going to be changes to the point in time count and how they approach it next year, so that'll be something we can forward.
And also, Chair, just a point, procedural wise, it should be agenda items the questions are related to, so that wasn't
Well, I think
actually-
it's homeless, that's how we can draw
Well,
inference,
okay,
based on
alright,
what the
fine.
reports from both.
Yeah.
Okay,
Okay, that's good.
thank you. Any other
Thank you.
questions? Ms. Needham?
Thank you. I have a question, but I hope will be an easy one. I first just want to say on behalf of the South Bay Community Association in our neighborhood, I just really appreciate your support here tonight, staff and everyone on the committee. It's very heartening to get such a great response. My question will probably go to Jamie Rose, but I'm going to decide that now.
Yes, thank you.
A few years ago, the South Bay Community Association asked the planning department to give us a little primer on, we call it Development 101, a couple Capital staff created a fabulous little session for us, and I think they've gone on to cover that with other people. I was already thinking this about transportation when we talked about your transportation 101. So I'm just wondering if that's something that the transportation department could think about offering to community associations, just for us, if we can learn kind of how the process goes, you know, what kinds of things can we, where in the process can we get our input in, right? It's sometimes
So you want
time-
some information sessions that goes to all the neighborhood associations on the process used to create sidewalks, crosswalks, et cetera, roundabouts,
Like
Mr.
that.
Rose? Or Mr. Sims, whichever?
We're more than happy to. We're a little back on our heels with staff right now, but yeah, we're more than happy to come out. And anybody who wants to listen to us talk, we're always happy to.
Thank you. Any other questions?
I don't have a
Vanessa?
question so much as an ironic thing. I'm sitting here at a safety meeting and my daughter who's 14, she go to the park in Knox Hills with her friend. This is the text I missed about 3 minutes ago. So me and Zoe stopped by the park, but there were a ton of homeless people, so we left.
Yes, we're quite aware of all that, and it's something that, you know, it's gonna come up, it's gonna come up constantly, and we know that. This is a bigger problem than just the city. We have to get the province involved. The province is stepping up in certain areas, other areas they're not. The city, as you heard, $500,000 to warming centers, which is not our responsibility. Think of the sidewalks could have been built for that 500,000, right? So we have to think about the provincial downloads, and we're always pushing back, but if we don't do it, people are gonna die on the streets, right? It's sad that that's where society's come to, but there actually is supposed to be a process for question period. I'm sorry, Ms. Gurry, but I'm gonna have to end it here because our staff do have to leave.
Oh, yeah.
So motion to adjourn? And then I'm more than willing to stay and answer questions if you have them now, but we do have to let our staff go.
What about your committee? Do you have to let them go?
Motion to adjourn by Councilor Eastimer, seconded by Colin, all in favor. Motion carried. Thank you all.